The other is isolation and quarantine. We have talked about this from the very beginning, but there's continued to be a lot of questions, particularly in the last week, so I want to speak to both isolation and quarantine and then provide some new information just released by the CDC, and the Centers for Disease Control. I'll try not to cough. One, isolation is a very specific term that refers to people who are actually ill. So isolation is used for people who are known cases of COVID. That's a person who's tested positive or is identified as a probable case by definition. That person must remain isolated away from other people for a period of 10 days, that's 10 full days, and they have to be symptom-free for 1 day. That was previously 3 days, so now it's 1 day without medication, and then they can return to work. It's really important. So again, if someone is positive, they have to be out of the workplace and isolated at home or a hospital setting, but ideally at home, for 10 days, and then 1 day symptom-free, they can return to work. For someone who is symptomatic, unfortunately, that may take 20 or more days for them to be symptom-free before they can return to work.